Stephanie, and I'm going to be hanging a primary IV bag for antibiotics. The doctor has ordered 1,000 milligrams of vancomycin as an antibiotic. The patient has MRSA, so we're going to be delivering the vancomycin so he can get better. Right here I have 500 milligrams of vancomycin per milliliter. So with this calculation, that means I'll be giving 2 milliliters of vancomycin. So I'm going to draw that up. Okay. And now I'm going to add that to the solution. Throw that into the sharps. I'm going to mix up the medication, and then I'm also going to label on the back side the medication, the dosage of the medication, my initials, and the time of administration. That being said, I'm going to put that on the tubing. I will connect the tubing to the medication bag. I'm going to be careful with inserting the tubing because we want to maintain sterility. Okay. And I'm going to hang that right here. No, I'm going to bring it into the patient's room. After you put the tubing on, you want to prime it. Close that off. I'm going to get a syringe filled with 6 milliliters of normal saline, and I'm going to bring that into the patient's room. Hello, my name is Stephanie, the doctor, and I'm your nurse today, of course. The doctor's ordered vancomycin to treat as it's an antibiotic, and it's going to help treat the MRSA. Okay? Okay, so I'm just going to hang that up here. What I'm going to do is check the IV site to make sure there's no signs of phlebitis or infiltration, and there is none. So that being said, I'm going to clean off this port here, go in with my normal saline, okay. And I'm going to aspirate. I have to unclamp it first. I have to aspirate, get some blood return, okay, and we're going to assume that means that it's patent. So we're just going to flush with 3 milliliters of normal saline using the push-pause method. And after we do that, we're going to take another alcohol wipe, clean off the port again, as well as the port of the IV tubing. We're going to put that on there. Okay. Now we're going to unclamp. Okay, and vancomycin can be run at, this vancomycin will be run at 8 drops per minute for an hour. So we're going to make sure that we have a flow rate established, and I'm going to check on my watch 30 seconds to see if the right amount of drops flow within the 30 seconds, and if it does, we're just going to adjust it accordingly. And after we're done with that, then we will let the patient know that we will be back within the hour to check on them and to stop the medication bag. And before I leave, I'm going to look at the IV site, make sure there's no phlebitis or inflammation. There wouldn't be right now anyway, but we're going to check that. We're going to put the patient in a comfortable position, make sure he's not in pain, make sure the bed is lowered, see if he has to go to the bathroom or anything, and put his personal belongings back. An hour later, I will come back into the room and I will stop the medication, but I will look for it at the IV site to make sure that there's no phlebitis or inflammation from the medication. And what I would do then is get another alcohol wipe. I'm going to undo the IV tubing. Of course, I have to clamp it all beforehand. Clean it off and apply a new alligator clamp to maintain sterility, because the bag can be used for 24 hours. And I'm going to flush again with the rest of the 3 milliliters of normal saline using the push-pause method. Alright, we're going to assume that means that that's a patent vein right there, and I'm going to hold down positive pressure while I clamp the tubing to maintain positive pressure. Take that off. And once again, I'm going to assess the site and make sure the patient is comfortable, is not experiencing any pain, and making sure their personal belongings are with them and putting them in a safe position. And that is it for the primary bag.